Good morning, my people in the back. Good morning.
Morning.
Hi, my able driver. Are you my driver? You're not my driver. You actually my colleague. Now, morning, everyone. This is us. We are driving from Busia. We are going to our next place of assignment where we are having a medical camp in Musanda area. Mark Emitati's background. Yay! Wapinduru ya Mark. Anyway, on a serious note, guys, as we drive, we want to do our reflections on how this thing has been. How are you, Mr. Kanyangi Lusite? Good morning.
Good morning.
Okay, so tell us, how has it been? What's happening?
It's been good. It's been an experience of mixed emotions, and the camp in Busia, the mission in Busia has been successful because the team team with the CW have been able to help quite a number of patients who could not afford surgical procedures, and those who are on the list for a long time. So we managed to get the backlog, at least give the surgeons in that hospital Busia referrals a relief, because they had a long list and a lot of people were in need, but they couldn't, especially because of finances and because of the number of cases actually being waited on. So I could say that it's been a success on our part. No, it was a short stand, like it wasn't much, but we've managed to touch lives in a different way.
Yes.
So it's been a success from my side.
So I think the common narrative on the ground was the fact that a lot of patients could not afford mostly the implants, because unfortunately, even with SHA and all that, even some of them actually don't even have the insurance. But the common narrative was the cost of the implants was quite costly. So it was good for MedInsure to take the pressure off our patients by funding the implants, funding quite a lot, and I think that's you guys who have watched on my other video how people are so excited, families are touched and stuff like that. And like Lucita says, it is just a small thing, but I think it will go a long way, especially for those that have been assisted. So what was your highlight? What was your main highlight? Is there any particular patient that the story will live with you, or they were all the same?
Definitely they were not the same, and my highlight, I would say, is I think most of them were my highlights, but the most that I can the standing out one that I can pinpoint is the patient who had both legs. He got an accident and he had bilateral
TFs, tibia fibula.
Yeah. So he was so excited after the operation and he got the implants. He narrated how he had been waiting and he didn't even know where to get the 50,000 to get the implants, and how grateful he was, and the way he was excited to go back to his daily job. It was so touching, and it was just marvelous to see the joy, to see how he was looking forward to go back to his normal life. So that's one thing I'll say that it stood out.
Oh, excellent. All right. I think for me is which one? I think for me still is the story of the little boy, the 7-year-old, and with the infected joint and fracture, and to be able to get the antibiotics, to be able to get washout, and essentially, hopefully, it's the beginning of a long recovery. I know he will require a lot more care, and going into the future, he probably will have a bit of challenges here and there, but it is my hope that this is just the beginning of better things for him, and I'm hoping that he can start to make a recovery, and hopefully in the next couple of weeks he can go home with a grandma. So that's the main highlight for me. What did you think about the health professionals that were involved? What were your thoughts?
The doctors, the nurses, everyone who was involved in the mission, they went far above and beyond, because they worked so long hours through the night.
So tunnel.
And I know it was overwhelming, and but they never left any stone unturned. They actually went through. They had late lunch, late dinner. They slept late, and I would really want to commend them for that. And yeah, I can't even thank them enough, because it was so touching to see how people can be selfless and go just out of the way to make sure that the patients are well taken care of. They even followed up to see how they're doing, and just to make sure they're comfortable in the way they could be. And even some of the doctors and nurses who are the residents, or the resident, they actually helped even in screening those patients and just helping out to bring the patients, and just to make sure that everything is working out. Like, everyone was it was all hands on deck, and it showed how committed these professionals were, and especially the people in theater, even those who could, some of the surgeons who gave way for these cases to be done, so that they could even push their own cases forward. It was just so good to see how collaborative it was. So yeah.
I think you've rightfully said that. Oh, St. Vincent Secondary School attendant. You have to notice that. Anyway, I think, like you rightfully say, everybody was so selfless. I think for me is the coming early, the leaving late, and the mutual respect at work, despite the challenges, the resources being quite limited, and I must say the resources are quite limited. I think everybody just pulled up, showed up fully to make sure that this thing was a success. And I cannot forget, the cleaners. I cannot forget the people that made sure we ate on time. Okay, the food was always ready on time, but we never quite ate on time. And and just the people that have given us cassavas.
Yeah. Oh, the locals were great as well.
Yes.
Yeah,
Bananas, for me, I think my highlight is meeting some of my, my classmates. Oh my God. And just, seeing what your colleagues can do. Hey, I think Kenyan doctors are smart, super smart. The things they can do with limited resources, it's just absolutely amazing. And I know it's probably not the ideal, and things should change, hopefully, in future. But regardless of that, I know there are smart fellas that have the heart of the people at heart. And so I really commend them. I really commend them for that. What was I going to ask? What are some of the challenges that you've seen on the ground? What's the one thing that you would tell somebody that you would wish, if you were ever to come back to Busia, you would wish it was changed?
I think
was better.
I think a lot of things need to be done better. I think a lot of things. If I start listing, I think I'll say it until tomorrow maybe, because the moment I stepped in that hospital, I felt like it was not for human being. For lack of a better word, it was so bad. And I realized even the patients don't have like bed sheets. They're just sleeping on like, what is it called? The plastic Macintosh. And that's, it's prone to the patients will get bed sores and all that.
Yeah.
From the toilets, and
I
couldn't even use that toilet myself. I can't imagine someone using that one. So it was dirty. Okay, there are something basic things like repairs. They have not been done. The beds are not good. I think there's a lot to be done, and it begs. It just makes me feel bad that our people are going through this. Hopefully, something can be done, and if there's anyone sleeping on their jobs, they need actually to wake up and realize that they're serving the people, and service delivery is nothing if you cannot make people comfortable. You have to give service to these people, the service that they can appreciate, not the service that you think is okay, because they need to go and check actually these people are comfortable. The other thing I realized is that not so many machines are working.
Yeah.
The lab is not working fully. The radiology department is crippled. People are going outside the hospital to get services like x-rays. So it's something that really needs attention. I don't know whose attention, but the buck stops with the leadership, which is not even the hospital management, because there's now the county government who are responsible for this. They need actually to look into it, and they need to make it really working for the people, because there's no point of having a referral hospital that is not working.
Not functional.
Why should people be referred in that? Yeah. Why should people be referred to that hospital when it's not working?
Yeah.
So
exactly.
that's a lot of things are not working in the hospital. So something needs to be done.
Yeah, I think you rightfully, what I can take from what you've said, I think for me is immediate left, or we're going straight?
We're going straight.
I think for me the biggest, like you rightfully say, is I just wish there was a functioning on the basic. I mean, an x-ray is something that a lot of people can have. Even small startups normally have an x-ray. Going straight? So I think that is important. That needs to, that needs to definitely change. I mean, right?
Yeah.
So basic things like you rightfully say, x-rays, blood tests, and stuff like that. So very, very important for those to sort of happen. And I'm hoping that this can actually happen, because we are arriving where we were going. We'll probably wrap up. And do you have any last words? Semi-last words?
I want to say that the people of the county of Busia and the people of Kenya, they deserve better. They deserve better services. And I know it's a lot of things need to be done, and I'm maybe just urging people out there, if you can help in the little way that you can, and to alleviate these kind of problems, let us just come together and do that. And then we need again to hold these people accountable.
Yeah.
The leadership of the hospitals and the county government, they need to know that we are not begging for the service delivery. We are demanding for that, and the people need dignity in the service delivery.
Yeah. So there you go, guys. We clearly had a successful mission in Busia, despite the challenges, despite the shortcomings. The team pulled together, and I think our patients are happy. But like Lucita has said, a lot more needs to happen. Somebody needs to do something more, and all of us, if we can help in any small way, let's endeavor and strive to do just exactly that. Okay. God bless you, and see you in the next video.